Good morning, sir. My name is Inkiawa and I will be your student nurse for today. You are?
Joel.
So for today, I will be assessing your mouth, nose, throat, and sinuses. Then next is to prepare all the equipments needed. Inspect the external nose briefly and note for the symmetry. So as I inspect, his nose is located at the midline. It is symmetrical. And the septum is in midline, no swelling, lesions, and it is not bleeding. The next is slightly palpate the external nose to determine areas of tenderness, masses, displacement of bone and cartilage. So as I inspect, the external nose has no any tenderness, masses, and displacement of bone and cartilage. The next is to determine the patency of both nasal cavities. Sir, mabayan cover dyan may sa nose yung inhale, exhale. Sir J. Bangon. Inhale, exhale. So as I inspect, both the patency both of his nasal cavities is normal. The next is to inspect the nasal cavities using a pen light or nasal speculum for the presence of redness, lesions, swelling, and discharges. So as I inspect, there is a bit of hair in his nose and there are no any redness, swelling, lesions, and discharges. The next is to palpate the frontal and maxillary sinuses for tenderness. So as I inspect, no tenderness and no discomfort during palpation. The next is to percuss the frontal and maxillary sinuses for tenderness. So as I percuss, there is no tenderness. The next is to prepare all the equipments needed such as sterile gloves, pen light, sterile gauze, and tongue depressor. So the first procedure is to inspect the outer lips for the symmetry, contour, color, presence of lesion, and texture. So as I inspect, his lips is symmetrical. The color of his lips is pink, and there are no any lesions, and the texture is moist. Then next is to inspect and palpate the inner lips and the buccal mucosa for the color, texture, and presence of lesion. Sir, can you please open your mouth? So as I inspect, the color is pinkish and it is moist and soft. So next is I will be palpating his lips. Sir, iungat mo to. So as I palpate, there are no any presence of lesions. Then next is to inspect the gums and the dentures. So as I inspect, he is not wearing any dentures, and his gums is pinkish and there are no any lesions, bleeding, and he has a complete teeth. Next is to inspect the surface of the tongue for the position, color, and texture. Sir, can you please open your mouth? So as I inspect, his tongue is in midline. It is pink and is smooth, and there are no any lesions. Next is to inspect the tongue movement and base of the tongue. So as I inspect, he is able to resist the pressure and his tongue has a adequate movement. Sir, can you please open your mouth? And sir, mabayang paki nga to dyan tongue niyo. So as I inspect, the base of his tongue has no any lesions. And next is to palpate the tongue and the floor of the mouth for nodules, lumps, or excoriated areas. Then examine the floor of the mouth and check for submandibular duct stones or masses. Sir, mabaling pakiwag yung tongue niyo. So as I inspect, there are no any lesions, nodules, and lumps. Is to inspect the hard and soft palate for the color, shape, texture, and presence of bony premises. So as I inspect, the hard palate is whitish and bony, and the soft palate is pinkish and muscular. Is to inspect the uvula for position and mobility. So his uvula is at the center and it moves up and down. Is to inspect the posterior oropharynx by depressing the tongue and asking the patient to say ah. Then note for any tonsillar enlargement, redness, or discharge. Sir, paki-open dyan mo. Ako na. So as I inspect, there are no any tonsillar enlargement, redness, or discharge. Is to elicit gag reflex. So for the normal findings in the elicit gag reflex, it must be intact.